So remember, this is the basic pattern that we use, is we're always going open-ended. And this is what the script follows. The script is a more specific thing, but at any given, when you get into need, so we did the, what's the severity, what's the duration, blah, blah, blah. And
let me when you are because I'm reading the other literature here you have, it's much more involved than this here, and it does go into the second day, but it goes into, when you're talking about digging, are you talking about when you get to need, you start to dig a little bit in their need?
yes,
Because one of the things that I would do is I would, like you were saying, the black belt thing, that I would ask them, you know, is this, you know, bothering with your activities of daily living, you know, showering, you know, vacuuming, whatever. But then I get to the work part and I said, you know, have you missed any days of work because of this?
yeah.
And they'll say, well, yeah, I have. And I said, is that a problem at your workplace? I mean, does your supervisor get upset with you for not showing up for work? Yeah. And I said, well, if this gets any worse and you have to keep calling in, is that going to jeopardize your work status?
Right.
And is that what you're talking about by digging?
Yes.
Or should we, this is the first day.
Yes.
This is when we get to the primary need, first day.
Right.
And I zero in on the most important one, which would say it's work, right? And this person is scared about their work. That's what we want to try and find out, is that, are you worried, right?
Exactly. The primary motivator, and when we say what motivates people, is always emotion. It's always a fear-based emotion.
Right.
So there's positive emotions and negative emotions. Negative emotions are 5 times more powerful than positive emotions. People don't do things when they're fat and happy.
Yeah.
They do things when they're, you know, and the best things, yeah. And that's, you ask the personal trainers, who works out harder? The newlywed, the gal who's engaged and about to get married and wants to look good on her wedding night, versus the recently divorcee. The end goal for these is always to get to this, and you'll know when you get it because you're watching the non-verbals. You're watching the emotion. I always jokingly say, get them to cry. If they're crying, you found it. Good job. You know?
Yeah.
And the big one, I don't think you'll have a problem with this, but the weaker doctors, the more insecure ones, are uncomfortable with emotion. I was, but now I like it because I understand what it is. And I feel honored that they're sharing it with me and that they trust me. And so I don't run for it. I embrace it. And I'm learning to do this with my own emotions. When I have negative emotions, I run for them. And now, you know, I'm like, embrace them, feel the emotion, recognize it for what it is. It's a part of you. It doesn't control you, but you see what I'm saying? So we're trying to help them do that. And it's a very rewarding experience when the mom looks at you and goes, I'm a bad mom. And I look at them and I'm like, that sucks. I've felt that way before.
Yeah.
Let's fix it. And now they know, they're like, he gets me. That's what you want. You want them to go, he gets me. So this is your tool. This needs to be in your toolbox, and you can use this in any situation in life, but it's always when you're, and this is the tool, and I always call it the tool for mind control. I'm going to control the discussion through questions and get the information that I want, which is your emotion behind it. So it always starts with an open-ended question. So let's review really quick. The purpose of the open-ended question is, how is this affecting your life? Broad, and it lets them share anything that's on the top of their mind.
Gets them talking.
Yep, it gets them talking. Now, it only gets them talking if there's a present concern, if they're aware of it. Are you aware of how this is affecting your life, is really what you're asking. And they'll say, yes, I'm a bad mom. But this only works anywhere from 40, it works from 10 to 50% of the time.
Yeah.
And that's fine. We don't care. This is just the first step. And, you know, up to 50% of that, they'll just tell you, and you'll go, oh, I'm a bad mom. My back hurts and I beat my children and push them off the bed, you know.
And some people will say, it doesn't affect my life.
It doesn't.
And then you're like, well, what are you here for then? Why are you here?
Exactly. Well, that's a little too aggressive. So
I
we're gonna be a
know.
little gentle. So when they do that, then we're gonna go and we're gonna poke a little deeper into the three categories that we know for chiropractic, which is what are the three categories we know it actually does?
What the problem they're having?
Yeah. What areas of their life are usually the most affected by neck pain and back pain and headaches?
Well, it's usually their
Work,
work.
sleep,
Well, their work, sleep, and
self-care, showering,
self-care, showering,
bathing, chores around the house. If you're old, it's
Yeah.
yard work. If you're a female and old, it's quilting,
Right.
or a hobby. If you're young, it might be sports and athletics.
Okay,
These
I see
are
what you're
general
saying.
broad categories, but this is self-care. You need to be aware of these because you're going to ask much more specific questions.
Okay, I see what you're saying.
So it goes like this. How's your relationship with your family? What kind of a question is that?
Well, they take it as a personal question.
No, that's an open-ended
Yeah, it's
question.
an open question.
And you say, fine. Unless your mom's in the hospital, then you might say, well, my mom's in the hospital,
Yeah.
right?
Right.
But if your mom's not in the hospital, or even if she is, then I'm a stranger, you might just say, everything's fine.
Right.
I'm unhappy with that answer. So I'll go, how's your mom? What's her name? How's your relationship with your mom? Now, if she's doing good, you'll be, she's fine.
Mhm.
And if I want to pursue that, I can by getting more specific. You see what I'm saying?
Yeah.
So I just increase specificity to force you to give me the information that I want. But if I go, how's things with your mom? And I use that, I go, what's her name? Because that really forces you to think about her. You see,
Right.
if you want to resist me, you can, but it's harder.
Yeah, it's hard.
See, your mom's sick, you don't want to talk about it. I say, how's your family? Fine. How's your mom? She's fine. How's her health? When's the last time you talked to her? See, I can dig.
Yeah,
but
you can
I'm trying to, yeah. So I go, how's work? Does this affect you at work? Not so much. So you work just fine. Now, again, I'm watching you because if I go, how's things at work with your back? And you go, good. You
Then
see,
you're going, you're hiding something.
I'll even look at them and go, you hesitated. Or I'll look at their spouse who smirked.
Yeah.
Man, I'm on it. So now I'm digging after it. What do you mean by that? And I'm digging, see? But if they go, oh, we're totally fine.
Yeah.
I move on. What about sleep? Because I know they're not in here. They can't hide from me. You're in my office.
Mhm.
One of these is affected, and I'll go through those. Now, there's actually about 15 different things. There's work, sleep, hobbies, exercise,
Mhm.
dressing, bathing, blah, blah, that fit in these categories. And I'm just going to dig. It could be golf.
Yeah.
But I'm going to dig until I find one.
Let me ask a question though. When you're going through these, and he tried, you say, well, how's this affecting your work? Oh, work's fine.
Mhm.
And you're like, and you know that if he's got this pain sitting here now, he's got this pain when he's at work, but he can still do his work.
Mhm.
So wouldn't the follow-up question be, well, do you have this pain while you're working?
Yeah.
And then he says, yeah, I do, but it doesn't prevent you from doing your job. No, it doesn't. Okay, then you move on.
Right.
But at least you've anchored that you've got this at work, which you shouldn't have this at work.
Now, why would you move on if you're sure it's affecting them at work and they're denying it?
No, I'm going off. I'm going off the
Why
fact
would
that
you
it's
move
not
on, though?
affecting him at work. But
Well,
it's
you
there.
know it is, and it's there, and
Yeah.
you know it is affecting him at work. Why would you ever move on? Do you want to keep digging and digging and digging, or do you want to move on?
Well, I'm kind of going by your playbook. If he says, if I say it's affecting your work, he says no. I said, well, is your back in this pain when you're at work? Yes, it is. I said, so it doesn't affect your productivity at work? And he says no.
Right.
Right. And
I sit all day. I'm miserable, but my job is customer service, and it helps me because I'm grouchy. Because the reason is you're not allowed. You know stuff, but you're not allowed to make assumptions.
Right.
So you dig for clarity. So here's how this works. It's emotion based, and he gets to determine his emotions. We never make assumptions.
Yeah.
We do, but we confirm, and we're open-minded. We're listening to them. So here's the rule. If I ask you an open-ended question, then I start digging at work, I call it the 3-strike rule.
Yeah.
and you ask 3 times, so this doesn't affect your productivity? No. This doesn't negatively impact you. You're able to do your job effectively? Not really, but I don't care. And I can ask one more question. And we call them resistances.
Yeah, pushback.
Yeah, pushback. He pushed back twice.
Yeah.
Generally, if they push back twice, you can get away with sometimes with a third. But if you push again, come on, this isn't effective.
Wall goes
yes.
up. Yeah.
Why, if you push 3 times, does the wall go up?
Because he's assuming you're not believing what he's telling you.
Yes, you're not listening. And you said believe, which is exactly correct.
Yeah.
But you're not. I told you 3 times.
Yeah.
So that's when we flip it to the reverse negative. The reverse negative is that last pitch. And this one is some very strong psychological principles, but basically it forces him to say, yes, this has no, and so we call it the reverse negative because it goes like this. It goes, so you're telling me, Dr. Sabo, that this has absolutely no negative impact on your work whatsoever, that you work just as good with the back pain as you do without, or in your case, you don't care. You don't care. You don't mind having this back pain at work at all because your performance is just fine. Is that what you're telling me?
Mm-hmm. Yes, that's what I'm telling you.
And the reason this works is because it's very hard for someone when you make it absolute, when you do get a hit. So this is your formula. When you do get a hit on the emotion, if you're not paying attention when they start getting emotional, you'll move on. But that's where you go, yay, you want to get excited, not physically. Oh, this is screwing you up at work. I'm so excited. You're unhappy with your body. That's awesome. No, it's okay. Let's think of Freud. He's like, oh, let me tell you about my mom. Yeah. He gets excited. He goes, oh, we're on to something. I found it. I found what I was looking for. Now tell me more. Now I'm all ears. Tell me more about this, how it's affecting you, and get comfortable with those emotions. And this is where people are trained not to, because this is intimacy.
Yeah.
And you have to be comfortable with intimacy because this I used to run from this and be uncomfortable. Now I'm excited about it. I'm like, this is what I crave. I love being intimate with people. Share me. I felt honored that you would share with me. You were like, you shared a couple of really personal things. You're like, I don't feel good. I've been in practice all these years. I've got all this experience and I don't feel like you even mentioned, I don't feel as successful as I think I should be. Well, that's a horrible feeling.
Yeah.
At one point you were, and you go, I lost it.
Yeah.
I want that back. And I'm like, I'm honored and I would love to be a part of that. Who would want to be a part of helping somebody get to where they want to be?
True.
That makes me excited. That makes me emotional. That makes me want to get into work today.
Right.
I'm not doing this for the paycheck. Oh, I want the paycheck. That's a nice reward. But I'm like, I want to see you successful just to be successful. That's why the new docs that we're getting in, they're both amazing doctors, but I'm going to be able to help them a little bit. The new guy, I'm going to help him a lot.
Yeah.
So I want to work with him 10 times more, but he's 10 times the work, but I don't care. Yeah. And that's the patient. Now I'm getting emotionally connected to them and I'm going to do a better job for them. I wake up at night sometimes going, oh, shoot, if I don't get her going on her exercise, because I've turned over a lot of my patients, but I'll come in and, hey, how's this patient doing? Because I got emotionally invested. And that's going to make a difference in your practice when you start emotionally connecting with these people. They walk in and you don't see somebody, Hernandez, who's doesn't get it about his low back pain and isn't listening and never does his exercises. Now, when you walk in, you're going to be like, what can I do to get this guy, because you're emotionally connected to him. So this benefits both sides.
Exactly.
So makes sense? So but this is your tool to get there, to make it comfortable, to understand your limits. I don't want you pushing too hard. I don't want you pushing. Most doctors don't push hard enough.
But when they relent and they
that's the reverse
and they
negative.
give you with when they relent and go, yeah, you're right. Yeah, it is a problem for me at work.
Yeah.
And then I go,
tell me more.
Thank you for sharing. Tell me more. This has given me a huge picture into how I can get you.
This is very important for me to understand.
This is very important for me to understand.
Yeah.
And to formulate, what it is we're going to do to make you better.
Yeah, and also this gives me a goal. You got, and I'll say this to them. So the other reason, I know I'm pushing. Sometimes they get annoyed with me, and then I'll go, look, hey, I apologize for being so pushy with my questions, but I really want to know every patient who comes to see me comes in because it's how it's affecting their life, you know.
Exactly.
And I really want to understand how it's affecting your life so I can make a goal. I don't want to fix your neck pain. I want to fix your job. I want to fix your ability to sleep. So I apologize if I seem pushy, but I really am looking for a goal for me.
Yeah.
How can I help improve your life in
Yeah.
some way? So,
Yeah.
and then they back off and they go, oh, you know.
Yeah, we're just on a fact-finding mission here.
Yeah.
We're trying to get as much information as I can so I
And
can
you've got
help
a
you.
great personality, Dr. Sabo, so it's not going to be a problem for you to sense they're getting upset. But remember, this big mistake is not pushing too hard enough. And this framework gives you safety and security to where you know exactly what to do to dig for those and to know if you don't find anything to give up. So the other thing, the last tip I want to give you is you will occasionally 20 or 30% of the time hit dead ends or heavy resistance where they just are in complete denial. And in that, this should only take 5 minutes. And
you gotta know when to cut it off.
Yeah.
Yeah.
And the other thing, you know, is remember, you're trying to wake them up. And some people are just hard to wake up. And you can see that if you push harder, that it's going to deteriorate the relationship. And so the thing to remember is you switch it. So the primary motivator is how it's affecting them right now. But probably 30 or 40% of patients that come in are actually not quite to that point. They came in because they're worried about future pain and problems. So, and that's a big one. So not only do I work on the primary motivator, but I also want the secondary motivator, which is almost always future pain.
Exactly.
I'm worried. Are you worried? So it's not affecting you at work right now, or it does to a degree, but not enough to affect your success. Are you worried about this getting worse? What would happen if this got 10% worse, 50% worse? This has been going on for 3 months. Are you worried that this is going to get worse? See, these are all, and I bring this up because.
So when you do that, are we in a sense going back? Because when we establish their first complaint, their main complaint, and then we dig a little bit, basically this has been going on for 15 years, and I've established with them that yes, the frequency is more frequent, the intensity is more pain, and it's lasting longer. Not days, now it's weeks with each flare up.
Yeah.
What does that tell you? And then we move on and we get down to this part and we can go back.
Yeah, because when we did it the first time, we were going for facts.
Exactly.
And details, but we didn't go for emotion.
Well,
you
so
could.
When we're in emotion though.
Now we want to go back, and because you did a good job.
To qualify it.
And do you know how great it looks when they bring up work and you start talking about future pain and you ask the question, you know, a few minutes ago, you told me that it was getting more frequent and more severe each time. Does that scare you at all?
Yeah.
Do you know how good you look when you go, I was listening carefully. You're important. Your details were important to me. And now I'm bringing them back up and I'm personalizing it. That's black belt. That's black belt. And they just go, good point. And what's amazing to you is you go, this is stupid. And they go, I've never thought of that before. And you're waking them up.
Yeah.
And they go, now I'm thinking about it. And that does bother me. And there was this underlying reason. Or they'll say, yeah, I worry about that all the time.
When you hit that moment where it's the wake up moment, do you see a change in their body?
Oh yeah, you're absolutely looking for that. You're looking for the surrender where they just go and they start to break down emotionally. You're looking for that. We call it the admit phase. Remember, this is a sales process in a very real sense. And the first thing you always do is try and get them to admit there's a problem. Here's what I want you to focus on. The whole point of this whole lecture, I'm giving you tips and clues, is memorize that formula, practice it all the time. Practice it on Elena in your office. Practice it on your employees. Well, I want to give you an assignment, if that's okay.
Yeah.
Is that every new patient, I don't know whether you have 1 new patient or 10 new patients from now until we meet next time, at the end of every single day, you want to stop. And I would have my front desk person ask me, but okay, you saw Ben and Steve today. Did you get their need? Did you find their primary motivator? Did you bond with them emotionally? Did they reach a point of emotion where they shared with you and you watch the admit where they go, yeah, this is, I am worried about this, where they said something, and you want to make sure, did you get to it? And that's what you want your, next week I want you to come back and said, I had 7 new patients this week, and all 7 of them, I will tell you off the top of my head. That's what I do this with my doctors, and I can always tell the ones who are going to be successful, because they'll go, what was Steve's problem? Oh, well, his problem was neck pain. What was his need? Oh, here's how it's affecting their life. And what bothers me is some of these guys, when they'll go, I don't remember.
Yeah.
Then you didn't, because you remember emotion.
You
forget
remember if you
facts.
took them through that process.
If you research. So we want to know next week, and actually, if you wouldn't mind, just have a list. Say, I had 4 new patients. These are their
No, we'll
names,
do it.
and this is how. this is what their need was. This one, it affected their sleep. They were losing 30% of their sleep, and my goal is to get them sleeping through the night.